For those of you who are not, we ask you to please be seated and enjoy your salad. Dinner's going to be served after the ceremony, so we're going to get started in just a minute, but do enjoy your salad. And then keep going. I am honored to be opening up tonight's program where we will all be recognizing the Academy of Emergency Nursing Fellows class of 2023. Shortly, yes please, thank you. Shortly, we're going to introduce you to these amazing emergency nurses who have exemplified the excellence ENA aims to bring to the emergency nursing community. As a brief reminder, the Academy of Emergency Nursing was established in 2004 to honor nurses who have made enduring and substantial contributions that have had a significant impact and who will continue to advance the emergency nursing specialty. The Academy provides visionary leadership to the ENA in many ways, and fellows have played an important role in emergency nursing practice, education, research, leadership, and public policy. To date, more than 200 outstanding emergency nurses have been recognized for their contributions by being named as a fellow in the Academy of Emergency Nursing. I am pleased now to introduce an amazing group of people, the 2023 Academy of Emergency Nursing Board. And as I call your name, please join me on stage for a group photo, starting with our 2023 Chairperson-elect, Patty Coons-Howard. Member-at-Large, Dina Brescher. (2023) Immediate Past Chairperson, Nick Shimolewski. And our 2023 ENA Board Liaison, Ute Brewer. And I'm sure you've already noticed Member-at-Large Jim Holtz, who is unable to be here with us today. Becoming an Academy of Emergency Nursing Fellow is one of the highest honors an emergency nurse can receive, and our board is thrilled to induct the 2023 class this evening. As you'll hear very soon, each inductee has made and will continue to make enduring and substantial contributions to the specialty of emergency nursing. And I'd now like to ask 2023 Chairperson-elect Patty Coons-Howard to call forward the 2023 class of fellows. Patty?
Thank you, Andy. I'm very honored to introduce this year's class of fellows. Our first inductee is Barbara Baldwin. Barbara's significant and enduring contributions are heavily focused on injury prevention by way of community education. Nearly 33 years ago, she leveraged her entrepreneurial spirit by founding the Safety Wise Babysitter Training Program Corporation. The company's mission is promoting responsible youth for helping kids. They operate a franchise model and have offered programs in all 50 states. The program trains students who are children of former students, as well as documents cases of lives saved as a result of course training. Barbara has furthered her philanthropy by establishing a foundation which supports her education through grants. Her contributions have been recognized through the Judith C. Callahan Award in 2022 and the Gail P. Lenahan Award in 2020. In addition, she was named the 1994 Emergency Nurse of the Year by Texas ENA. Barbara inspires community safety by focusing on babysitter preparedness. She is currently a small business owner of multiple companies. Barbara, welcome to the Academy.
It's quite an honor. ENA, I've been with them for 50 years now, and it's just neat to see it evolve. The friendships that you make, and it's a family. It's definitely a family. And so it's an honor to move forward and try to mentor others to get them in. Thank you.
Our next inductee is Dr. Michael Callahan. Michael's enduring and substantial contributions to emergency nursing are in the area of research. As one of the only nurses in the world formally trained in biomechanics, Michael's research explores ways to prepare emergency nurses, both physically and mentally, to prevent musculoskeletal injuries, particularly back injuries. He continued his biomechanics work by partnering with a team of electrical engineers to develop and patent a shoe-based sensor system that can detect the angles of the joints in the lower extremities and thereby possibly predict risk for microtrauma related to poor body mechanics. Michael has published biomechanics-related work 7 times in the last 3 years, which have been cited 54 times. To date, further establishing his goal to keep nurses safer through biomechanical advancements, he has transitioned to a role in North Carolina, but prior to that was assistant professor at the University of Alabama and continues his bedside emergency nursing practice as well. Michael, welcome to the Academy.
I didn't know I was going to have to say anything tonight. But I am honored to be here and to be included. It means a lot to me. 25 years ago on the beaches here in San Diego, a lieutenant looked at me and said, "You're going to change the world." And before I could tell him that he had changed my world, he was killed in combat. So to come home and to achieve this honor, it means a whole lot. So thank you.
Our next inductee is Dr. Bradley Gadel. Bradley's yes. Bradley's enduring and substantial contributions are in education and practice. He developed an international emergency care conference in Vietnam, which was attended by hundreds of nurses and brought content to an area previously without. He has repeated the conference in consecutive years. Regarding practice, Bradley created the EMBRACE pathway, Emergent Breast Abnormality Care and Evaluation, which has led to appropriate emergency diagnosis of breast cancer combined with early treatment, resulting in fewer emergent surgical consultations and fewer hospitalizations needed in this patient population. He is inspired to bring both educational opportunities to international audiences and practice advancements for breast cancer survivors. Bradley serves as an adjunct assistant professor at the Universities of Texas, Houston, and San Antonio, and also as an assistant director for the Office of Advanced Practice Providers at the University of Texas Southwestern in Dallas, Texas. Bradley, welcome to the Academy of Emergency Nursing.
Thank you, and you got the name perfect. I just want to say thank you so much. This is quite an honor to be inducted into the Academy. A lot of my mentors are sitting in this room, and I know that I wouldn't be here today if they didn't hold my hands and give me a gentle nudge. And I know you were worried about my name, and you got it perfect, so thank you so much. I appreciate it. Thanks, y'all.
Our Our next inductee is Mark Goldstein. Mark's enduring and substantial contribution to emergency nursing are in practice and education. He collaborated with the Department of Defense Military Training Network to ensure all RNs serving overseas obtained ACLS, TNCC, and ENPC prior to deployment, setting a standard for emergency nursing that remains a component of military training and readiness today. Now a retired major in the Army, Mark has served in various leadership positions, mentoring and leading 3 emergency department teams to achieve the Lantern Award. He shares his leadership knowledge as an author of 11 educational modules in ENA University, in more than 24 peer-reviewed publications, and as a frequent speaker at local, national, and international conferences. He seeks to inspire the next generation of emergency nurses through leadership and education. Mark is currently a clinical nurse in the ED at Denver Health in Denver, Colorado. Mark, welcome to the Academy of Emergency Nursing.
So I stay on script. Well, good evening, ladies and gentlemen, and new inductees. I'm honored and humbled to speak here today. I'm overwhelmed to be inducted into the Academy of Emergency Nursing with distinguished colleagues. Congratulations to my fellow inductees today. This is one of the highlights of my professional career, but I do have many people to thank to make it possible for me to be here today. I'd like to take the opportunity to thank my sponsors, Dr. Kathleen Flaherty and Kathy Robinson, for supporting me through this process. I would also like to thank my mentor and dear friend, Dr. Pam Borg, whose encouragement and support is greatly appreciated. I cannot thank these fellows of the Academy enough for supporting me during this professional journey. I'd also like to thank the Academy of Emergency Nursing, the Academy Board of Directors, and ENA. I'd also be remiss if I didn't recognize the most important people to me. I would like to thank my beloved wife, Lynn, and my children for their support over the years, the weekends, holidays, nights, birthdays, and special occasions when I worked. I'd also like to thank my patients, teams, and communities which I've served. Thank you very much, most sincerely.
I got ahead of my page turning. Oops. Our next inductee is Shante Harris. Shante's enduring and substantial contributions to emergency nursing are in education and leadership. She demonstrates ingenuity of the entrepreneurial spirit as a professional influencer via multiple domains. In her moderator role with the Black Nurses Rock Facebook group, she disseminates information to a community of 202,000 nurses who might need access to scholarships, research opportunities, and networking events. The group provides peer support, clinical knowledge, exchange, and discussion among Black nurses around the world. Shante leverages this group as well as other social media platforms to reach out and support historically excluded nurses. In furtherance of promoting diversity, equity, and inclusion initiatives, Shante has authored and presented on DEI and parallel human resources essentials at state and national levels. Separately, she is the founder and CEO of an education company that has reached more than 240,000 nurses worldwide, training approximately 30,000 nurse leader executives in the past 2 years. Shante strives to inspire greatness at all levels of emergency nursing practice. She is currently the founder, president, and CEO of Eminent Healthcare Resources Consultants, Inc. Shante, welcome to the Academy of Emergency Nursing.
I'd like to say thank you to my family, my mom, my sister, my aunties, Cassie and Chrissy, Dr. Anna Valdez, Justin Malici, for lighting this path for me. Thank you so much, Dr. Anna Valdez. For those of you who have come to the Academy before me, I want to thank you for lighting the path for me to follow. I am the first, but I will not be the last.
Our next inductee is Dr. Matthew Howard. Matthew's enduring and substantial contribution to the specialty of emergency nursing is in leadership, specifically providing resources and support for those impacted by workplace bullying and incivility. He led the collaborative creation of an international course, Bullying in the Workplace, Solutions for Nursing Practice, which has been completed by more than 400 nurses worldwide. The program enhances communication skills in high-stress environments, including EDs. His activity across organizations on this topic includes the American Nurses Association's Strength Through Resiliency Committee. Matthew's research publication, Educational Intervention Improves Communication Abilities of Nurses Encountering Workplace Incivility, has been cited 30 times in 2 years and won that journal's Innovation Award in 2019. He has published 3 articles about bullying and incivility within the past 3 years and presented 24 papers at 22 international, national, and state conferences. Matthew is inspired to continue working to eradicate workplace bullying and incivility. He is currently employed as a Director of Scholarship and Leadership Resources at Sigma and as an emergency nurse at Deaconess Hospital in St. Vincent, both in Evansville, Indiana, and as an adjunct faculty at Northern Kentucky University. Matthew, welcome to the Academy of Emergency Nursing.
Thank you. Again, like most of the others, I did not know I was going to be talking or saying anything. But the one thing I can say is a heartfelt thank you to all my mentors through the entire time of getting here, because it was a long road for me. Definitely my mentors, my friends, and my colleagues, Sarah Gray, Cheryl Whitus, who are my inspiration for getting in and actually doing this and actually pushing me to continue on. Of course, India Owens for reviewing information for us and really helping me to be able to do this. But actually, honestly, to my first couple of mentors in Kentucky, where there you are, in Kentucky, where I'm originally from, those nurses at the bedside are the ones who actually showed me the way to continue to do greatness and to continue to do things and never just stay. So thank you very much for this.
Our next inductee is Dr. Jacob Miller. Jacob's enduring and substantial contribution to emergency nursing is in practice, specifically in the emerging field of advanced EMS practice. His EMS contributions are related to interprofessional collaboration to elevate this subspecialty and textbook publications that serve as foundational references. Jacob led collaborative efforts between 15 professional organizations aimed at creating scope of nurse practitioners in pre-hospital care, and collaborated with a small work group of 4 EMS nurse practitioners across the country to co-author AAENP's position paper recognizing the specific area of EMS nurse practitioner practice. He has played an integral role on the University of Cincinnati's extracorporeal membrane oxygenation task force, where he is at the cutting edge of developing, disseminating transport emergency nursing care for high acuity patients during ECMO life support during air transport. Jacob is an inspirational champion for advanced practice in EMS. He currently holds multiple positions, most notably as the clinical educator and acute care nurse practitioner at the University of Cincinnati Health, Air Care, and Mobile Care. Jacob, welcome to the Academy of Emergency Nursing.
I've always wanted to say this. I'd like to thank the Academy. But seriously, thank you all for, thank you to the Academy of Emergency Nursing for recognizing me, and thank you to my mentors and my sponsors that have helped me to get here. This is a very exciting time in EMS practice, And I think that all of us who work in emergency nursing in one way, shape, or form have interacted with an EMS practitioner, whether that is receiving a report, transferring your patient, depending on where it is that you practice. And as our healthcare becomes more regionalized, recognizing the leadership role and the clinical role that advanced practice providers and even nurses play in that movement of patients from even tertiary care centers to quaternary care centers now. The tertiary care centers are shipping patients as well, so you can imagine the acuity. So aligning the needs of our patients with the care that they are provided in transport when they're outside of the well-resourced facility that they have come from, and they are now in the back of a small, sometimes very small, vehicle being moved miles, if not dozens or hundreds or thousands of miles from point A to point B. So I think that this is a very exciting point in time to be in EMS, to be in nursing, to be in emergency nursing, and to be in advanced practice emergency nursing. So thank you all.
Our final inductee this evening is Kathy Van Dusen. Kathy's enduring and substantial contributions to emergency nursing practice are in practice, specifically disaster nursing. She is passionate about serving those who live in at-risk settings during and after disasters. She spent the last 17 years serving on several DMAT deployments, bringing principles of disaster medicine to locations such as Fiji, where she trained Navy corpsmen, or in Peru and Ecuador, where she set up a triage system on the U.S. naval ship Comfort. In addition, after coordinating care for 250 cruise ship passengers who were being held under federal quarantine related to COVID-19, she became a sought-after expert on reducing COVID exposures in healthcare providers, which helped protect more than 6,000 healthcare providers in California. Kathy seeks to inspire emergency nurses to be prepared to respond to any disaster scenario. She is with the California 1DMAT, as well as being the clinical practice specialist for conference education with the American Association of Critical Care Nurses. Kathy, welcome to the Academy.
I am beyond honored to be in a room with my esteemed colleagues. I don't know if you realize that emergency nurses have looked up to you, and I personally have looked up to all of you and your accomplishments, and I'm humbled to be a part of this group. I especially want to thank my sponsor, Jean Prail, who really helped me through this process, and of course my husband of 41 years, Chris, who managed our 4 children while I ran off to do all these disaster things, and my sister and sister-in-law that are here to support me. Thank you so much, and California ENA, yay.
Thank you, Patty, and congratulations, just amazing congratulations to our newly inducted fellows. Welcome once again to the Academy of Emergency Nursing. Before I welcome this year's class back on stage to conclude our event and get to dinner, I'd like to thank you all for attending this evening's ceremony. As a reminder to all of our fellows, the annual Academy Business Meeting will take place from 9:30 to 11:30 on Saturday in the Convention Center, Room 9. Room 9, 9:30 on Saturday. I hope to see you there. Once again, fellows, colleagues, and guests, please join me in congratulating the 2023 Academy of Emergency Nursing Fellows as they return to the stage.